Hey, this is Dr. Goodman. I'd like to show you a case in progress that is having a really tremendous result using Invisalign aligners only. But I don't only want to speak to how robust Invisalign can be if you know how to plan it, and how there are so many misconceptions about Invisalign not being for complex case. But I really want to talk about using software like Invisalign in terms of simulating results before you decide to extract. Invisalign some 24 years ago introduced this concept of the ClinCheck, where you would move teeth on a computer in order to make the aligners. But really, what it also provides is great value in terms of being able to visualize how your teeth will look so that you make the right decision in treatment. And so here's severe crowding here, and you can notice how everything is inwardly displaced. Uh, Crowded, but inwardly displaced. The premolars are lingual. The lateral incisors are lingual. So I said, before we decide to extract, let me just see what it would look like if I expanded. Would I have to expand too much? Would the teeth be too flared forward or laterally in the final position? And so basically, as you see, we are moving the teeth into a wider arc, and it's my job as an orthodontist to say, are these teeth in a reasonable finishing position? And were the movements that were required to deliver that result realistic for aligners? And so I deem that to be the case, surprisingly. And on the upper, it's even more of a challenge because this patient had tooth number 4 that was completely displaced lingually. And reflexively, I would have thought to remove this tooth. But I said, you know what, if I do that, then I have to remove the other 3 premolars for balance, 1 here, 2 on the bottom. And when I saw the lower, I said, let me take a look. So I planned this out, broadening the arch in all dimensions, just using aligners at the proper sequence. So in other words, notice how tooth number 4 will really make its progress only once you have room for it, similar to the way we use coil springs with braces. And so this was my projected result. And we are about 14 months into it. And what you're looking at here is exactly the way the patient is in their refinement scan. And I might also add that we were able to achieve a difficult rotation of what looks to be a gemination or fusion situation of number 7. So I'm still going to put some finishing touches on this, but this really speaks to the value of simulating a result, especially if you're thinking about extraction, because in my 30-year orthodontic career, I have removed teeth in patients that in retrospect, I thought too much space was created. And now you can play this out and find out for yourself what your result will be if you either extract or don't extract. And I also, again, want to speak to the fact that Invisalign, it's a complete misconception that it is not effective for challenging cases. This case is about as hard as it gets, and it is playing out perfectly. We still have some work to do, but I'm really proud of this result, and I love using Invisalign whenever I have the chance. It's a great appliance.